Hi, welcome to Nurse Talk with Laur and Laur. This is our third video. We're going to move on and talk about some different forms of using technology in our workplace.
We're also going to look at defining some of the various systems for e-health and informatics that are utilized in practice.
So in our activity outline for this week, there are 6 terms that we are going to further discuss.
So the first one we have is the PACS, which is Picture Archiving and Communication Systems. So this is a system that allows for filmless capturing of digital images, so it can be viewed throughout the hospital. One of the benefits of having imaging on a database or on computer is that simultaneously different doctors can look at the same film in the same facility. They'll never be lost in the hospital, and you won't have to cancel your appointment, as some of the readings show. They'll always be available, and they save a lot of time and money. The next definition is for EMR or EPR, which electronic medical records and electronic patient records. So that's computer-based record keeping, and it allows clinicians to organize their patients and be able to keep everything together, such as their detailed demographics, medical and drug history, diagnostic imaging information, lab results, and everything is kept in one concise place, and not like a paper chart where you're flipping through everything. Everything is going to be together and organized. The third definition that was on our list this week was CPOE, which is Computerized Physician Ordering or Order Entry. One of the benefits of CPOE is that it can help reduce errors in the medical field by eliminating illegible orders from doctors, and the system can check the appropriateness of certain orders and give reminders when things are needing to be reordered. One of the examples I can think of for that is for narcotics, how many times you're caught with a patient who needs something for pain and it fell off the MAR, and you're chasing down the doctor, and it takes time. So this way, and electronically, will remind them to reorder the medication, and it won't be missed ahead of time.
Okay, so moving on to the next definition, which they all nicely relate to what Laura just talked about. We have telehealth. So that is one area where we're concentrating on efficiency and access. One thing that I did find in the research was that sometimes they felt that telehealth interfered with the ability to properly assess somebody, and it eliminated that face-to-face interaction. However, it is very useful for somebody who may be in a rural area, or depending on the time of day or the condition that they're experiencing, it's just the most convenient means to kind of get them in the right direction or figure out what they need to do next.
I hear a lot of people talking about telehealth. I've never personally called it, but do you have any experience calling?
I actually have, Laura. One time I was having a lot of pain. So what I did was I told them about my symptoms, what I was experiencing, and what they really did was they definitely indicated that yes, what I was experiencing wasn't normal, but it was also, it helped just ease my mind rather than me going and searching on the internet and freaking myself out. They told me about what they thought might have been happening and then gave me recommendations going forward. So whether I should see my family doctor if the symptoms persisted for another day or two, and what I could do at home to kind of help relieve some of the symptoms. Moving on to the patient portal. This is something that was a newer concept for me. I didn't know much about it, but this is where outpatients can access the portal and look up their lab results, or they can make or change appointments with their physicians, and it also provides a means of communication with their physicians or healthcare providers. The research found that it helped provide opportunities for these patients or users of the portal to increase their health literacy. Laura, do you know anyone who has used this service before?
I don't know specifically about a patient portal. However, I did have an experience a few years ago where I was having some lab work done at Life Labs, And they gave me a code, and I was able to go online and look up my own lab results, which was really interesting. Being a nurse, I could see what was going on in my own tests. The only downside was eventually the information disappears after a certain amount of time. So I don't know if it's exactly like a patient portal, but it sounds quite similar. And it was really fun, actually. I enjoyed it.
Okay. So moving on, the last part of our activity, we're talking about handheld devices. So any types of phone that we happen to use. What they found was that people were most likely to use those devices when using these services or accessing any type of health information. So as a result, the research does indicate that going forward, they're considering this. They're going to tailor ways to access this information and include resources that are optimized with mobile use.
Do you think that means apps and dashboards and things like that?
I think it would probably, that most likely, something like that. So I guess that really wraps up what we want to talk about this week. Thank you for watching.
And we hope you have a good week, and we'll see you again next week.